Hello, and welcome to the University Hospital Total Joint Replacement Education presentation. My name is Megan Doman, and I am one of the Orthopedic Spine Nurse Navigators. Thank you for joining me as you prepare for total joint surgery. This presentation will educate you and your family on your upcoming total joint replacement, hospital stay, and recovery. We will be covering many topics during this video, which include joint anatomy, pre-op, your care team, admission and surgical process, post-op hospitalization, your role in recovery, physical therapy, discharge plans, medical equipment, and physical and occupational therapy videos. Please access our videos for total knee, traditional total hip, direct anterior approach hip replacement, and shoulder replacement via the web at www.universityhealth.org. Once you have accessed the University Hospital website, you will then click on the Services and Departments tab, scrolling down to the Orthopedic and Spine section. Finally, click on Recovery and Rehabilitation. Under the Recovery and Rehabilitation tab, you will then see the anterior hip replacement, traditional total hip replacement, total knee replacement, and total shoulder physical therapy videos. There are several ways you will know it's time for joint replacement. For example, you may be having trouble getting out of a chair, walking upstairs, or standing up from the toilet. Also, you may have issues sleeping at night due to pain, or your pain medication may no longer relieve discomfort. Joint pain or immobility prevents you from completing everyday tasks, regular outings to visit friends, shopping, or vacation. The benefits of total joint replacement include pain relief, improved mobility, increased muscle strength, and maintaining personal independence. In the next few slides, we will discuss the anatomy of the knee, hip, and shoulder. The knee is a hinge joint. It connects the femur or thigh bone to the lower leg, which is made up of the tibia and fibula. A total knee replacement involves removal of arthritis, placement of a femoral component, a plastic spacer, and a tibial component, as seen on this slide. The hip is a ball and socket joint. It connects the pelvis to the femur or thigh bone. A total hip replacement involves removal of arthritis from the socket of the pelvis and head of the femur. And then there is placement of a new cup into the pelvis and head onto the top of the femur. The shoulder is also a ball and socket joint. It connects the scapular or shoulder blade to the humerus or upper arm. A total shoulder replacement involves removal of arthritis from the socket of the scapula and top of the humerus. Next, a new cup is placed into the socket and a new head on the top of the humerus. We will now discuss who will be involved in your care during hospitalization. Your orthopedic surgeon will be performing your surgery, oftentimes with the assistance of their PA or nurse practitioner. This team is in charge of your plan of care before and after surgery. The anesthesiologist or CRNA, otherwise known as a certified registered nurse anesthetist, will administer the medication that will put you to sleep during surgery. They also reverse the effects of these medications to allow you to slowly wake up after leaving the OR. Anesthesiology may call you the evening before surgery to obtain a medical history, review your current medications, and also remind you to not have anything to eat or drink after 12 midnight. The orthopedic nurse navigator is a nurse who educates patients and also coordinates services under the direction of your physician. Your rehab team consists of physical and occupational therapy. Physical therapy will teach you the exercises you will need to regain balance, stability, and strength. They will assist you in making a recovery plan following total joint surgery and will also evaluate the need of any medical equipment. If your surgeon orders occupational therapy, they will teach you how to move in an effective manner while accomplishing daily activities, often with the aid of adaptive equipment. Your nursing team from the Orthopedic Spine Center, located on the 9th floor, will carry out the plan of care as ordered by your surgeon. You will be in a private room after surgery and during your entire stay at University Hospital. A case manager and social worker make up the discharge planning team. They work together with you to develop a safe plan following discharge from the hospital. A dietitian will see diabetic patients and anyone who has specific dietary needs. The pharmacist will ensure medication safety during hospitalization, and chaplain services are available to be consulted at any time if you feel you are in need. A manufacturer's representative will be present in the operating room. Their role is to bring any hardware that is implanted during your surgery. They leave after hardware is implanted and do not perform any portion of the surgery. Once you decide it's time for total joint replacement, there are several steps to complete before surgery. First, you will schedule an appointment to see one of our orthopedic surgeons. The surgeon and his team will meet with you to discuss the joint replacement process and then schedule your surgery. Next, you will attend your pre-op appointment at your surgeon's office and then go over to the University Hospital Outpatient Center to complete your pre-admit testing and register for surgery. Then you will attend our total joint class and review your total joint book or review the course online. After surgery is scheduled, there are several adjustments you may need to make to your environment to ensure safety. Clear out any objects in hallways or walkways to allow for safe movement from room to room. Remove throw rugs or loose carpeting that could cause you to trip or fall. Consider placing nightlights in your hallways, bedroom, and bathroom for safety at night. Most home accidents happen in the bathroom. Purchasing a non-slip bath mat for your tub or shower can help decrease your risk of falling. Try to place kitchen and bathroom items at or around waist level for easy access after surgery. Also think about how you would like to spend your time during recovery. Books, crosswords, or other hobbies could be fine entertainment while recovering from joint replacement. After surgery, you will not be able to drive until your surgeon clears you and you are off narcotic medication. Before surgery, be sure to set up transportation to your appointments and physical therapy. Arrange for a caregiver to assist with meals, running errands, paying bills, and taking care of pets. We want you to be comfortable during your recovery, so pack clothes that will allow for easy movement during physical therapy and comfort during rest. Also bring shoes that will not only be comfortable but also sturdy. Bring toiletry items that you would normally use at home. It's never too early to begin preparing for total joint replacement. Preparations include attending total joint class or reviewing the presentation online, seeing your dentist for dental work prior to replacement, obtaining a medical clearance from your primary care physician or cardiologist, possibly donating blood, pre-op appointments at your orthopedic surgeon's office and at the University Hospital Outpatient Center. Be sure to bring all your medications in their original bottles to your pre-op appointment. In preparation for your surgery, you will want to make sure you are eating well. A healthy pre-surgery diet consists of lean meats and proteins, fruits and vegetables, as well as whole grains. Drink 6 to 8 glasses of water daily to stay hydrated prior to surgery, unless you are on a fluid restriction. Limiting the amount of fat and sugar you eat before surgery can positively impact your healing and stabilize your blood sugars. Patients who have diabetes can benefit from tracking and controlling their blood sugar prior to surgery, as well as eating a balanced diet. This is the University Hospital Outpatient Center. If you are facing the main hospital, it is located directly to the right and has its own parking lot. You will enter the building, use the stairs or elevator up to the second floor, register, and meet with your preoperative nurse. Here is the Outpatient Center registration desk. Once you check in and are registered for surgery, you will wait here until you are called back by your pre-op nurse. After registration is complete, you will go to a pre-op room. This is where the pre-op nurse will meet with you to obtain a health history, and you will be given information about how to get ready for surgery. Preoperative testing is done before surgery to ensure you are in favorable health at the time of your operation. It also streamlines the hospital admission process following the completion of your surgery. Your current and past medical history as well as surgical history will be reviewed and entered into your chart. Remember to bring all of your current medications in their original bottles to your pre-op appointments. It is extremely important for your pre-op nurse to record all of your medications correctly prior to surgery. You may have blood work, EKG, or chest x-ray done during your visit if ordered by your surgeon. A pre-op MRSA or MSSA nasal swab will be performed if ordered by your surgeon as well. MRSA is an antibiotic-resistant bacteria that can be carried by an individual unknowingly and not even cause illness. However, prior to surgery, patients are tested, and if positive, they are given an ointment to reduce the amount of bacteria in their nose. You will receive a set of chlorhexidine wipes. These wipes are to be used on the night before your procedure as part of your surgical prep. You will shower as usual, towel dry off, then use the wipes. Wipes are used on all parts of your body except your face, hair, or private areas. Allow yourself to air dry before sleeping in clean pajamas and on clean bed linens. Do not shave or remove hair from any part of your body. Place mupirocin ointment in each of your nostrils if called with a positive nasal screen. Bring your tube of ointment with you to the hospital on your surgical date. On the night before surgery, do not eat anything or drink anything after 12 midnight. On the day of your surgery, prior to coming to the hospital, place mupirocin ointment in your nasal passages if ordered, and bring your tube of nasal ointment with you to the hospital. Showering on the day of surgery is not required, but if you feel as though you need to take a shower, use non-scented soap and do not apply lotion, makeup, perfumes, nail polish, jewelry, hairpins, or deodorant. Do not eat or drink anything, including gum or mints, on the morning of your surgery. Bring your current medications in their original bottles with you to the hospital for review. They may be sent home with your family. On the day of surgery, you will report to the Surgical Care Center, otherwise known as the SEC. It is located on the second floor of the main hospital. Park on the second floor of the visitor parking deck and use the crosswalk to access the hospital. The Surgery Care Center will be on your left across from the second floor waiting room. You are allowed one family or friend to come with you into the Surgical Care Center. There is no food or beverage allowed in the SEC. Here is an example of a patient room in the Surgical Care Center. This is where you will get ready for surgery and meet your OR team. Once you check into the Surgery Care Center, your identity and procedure will be verified. A patient identification armband will be placed on your wrist, and when your nurse calls you back to your room, your identity and procedure will be verified again. You will be brought to a private surgical center room. Next, the nurse or patient care assistant will give you a set of chlorhexidine wipes and have you wipe down in the same manner you did the night before. You will also empty your bladder and change into a purple gown, non-skid socks, and a surgical hairnet. You will need to remove dentures, hearing aids, contacts, and jewelry. Blood work may be drawn and an IV will be started by the nurse. If the surgeon has ordered any medications before surgery, they will be given at this time. Generally, joint replacements are given a pain cocktail before surgery to help manage postoperative pain. You will be visited by your surgeon and anesthesiologist, also the circulating nurse, before going to the OR. The surgeon will review the plan for surgery and mark your surgical site with an O. The anesthesiologist will visit just before you go back to the OR to give you a sedative to relax and calm you before surgery, unless you are having spinal anesthesia. In the SEC, the circulating nurse will come visit you and will be the nurse by your side during surgery. This nurse will ask for a telephone number of the individual you would like contacted by the OR team via text alerts. You will receive an incentive spirometer to practice before surgery, and ankle pumps will be reviewed. If your room on 9 OSC is available, your friends and family are welcome to wait there, or in the surgery waiting room across from the SEC. You will use an incentive spirometer to help prevent pneumonia. This device works by helping open up your lungs and may cause you to cough. Your nurse will instruct you on how to use it before and after surgery. Generally, you will use the incentive spirometer 10 times per hour while awake. Ankle pumps are a good exercise to perform to promote blood flow and circulation in the lower legs and feet to avoid blood clots. They are done by flexing your feet back and forth as if pumping a pedal. We will have you do ankle pumps 40 times per hour while awake after surgery and during your recovery. Before you are given any pain medication, your nurse will ask you to rate your pain. We measure pain on a scale of 1 to 10, 1 being the least amount of pain and 10 being the most pain you have ever experienced. Your nurse will ask you what your pain is approximately an hour after the medication is given to ensure you are having adequate pain relief. In the SEC, you will receive the pre-op pain cocktail. During your surgery, your joint will be bathed with pain medication to help with pain management after replacement. On the floor or 9 OSC, pain medication will be given by mouth and through your IV around the clock. You will also be given pain medications as needed, which means they are ordered by your surgeon but are only given if you ask for them. Your nurse will be continually assessing your pain, but don't be afraid to ask for pain medication when you need it. After surgery, you will go to the recovery room for a minimum of 1 hour. You will wear oxygen and a pulse oximeter, which measures your oxygen level, have IV fluids, a blood pressure cuff on your arm, and possibly a hemovac drain. The drain is in place to draw fluids away from the incisional site using suction, and it will be emptied by your nurse or PCA. The recovery room nurse will be performing neurological assessments to ensure you have good sensation in your limbs. When your vital signs are stable and pain is under control, you will be transferred to your room on the 9th floor. Once you are moved to your private room on 9 OSC, you will meet your floor nurse. They will write important information on your whiteboard, instruct you on call light and TV remote usage, as well as changing out your orthopedic ice packs. After surgery, your vital signs and oxygen level will be checked frequently. You will be able to have sips of clear liquids and Jell-O to ease you back into eating a regular diet. We use gel ice packs on all total joints, which can make the limb feel heavy. Your IV fluids will be continued until the surgeon orders them to be stopped and you are tolerating regular food. You will also have SCDs or foot pumps on your legs or feet. These compression devices help to move blood back towards your heart to help prevent blood clots. If you have a hemovac drain after surgery, your nurse or PCA will empty the device and record the output in your chart. Continued monitoring of vital signs and oxygen levels allow the medical staff to see how you are doing right after surgery. Vital signs also help physical therapy assess your ability to get up and walk on the day of surgery. Physical therapy will see hip and knee replacements starting on the day of surgery. They will work with you to reach your individual mobility goals, teach you stair training and car transfers. The motto for stairs is up with the good, down with the bad. Therapy not only exercises your new joint, but also increases blood flow and promotes deep breathing. Occupational therapy, also known as OT, sees both shoulder replacements and traditional total hip replacements, and often visits on the day after surgery. If you have your shoulder replaced and arrive on 9 OSC before 3 p.m., OT may see you on the day of surgery. They will teach you how to move in an appropriate manner while accomplishing daily activities, often with the aid of adaptive equipment. Here we see an example of a typical 9 OSC patient room. On post-op day 1, your nurse will come into your room in the early morning to draw labs. This is so your surgeon can review them before he comes to visit you. When your surgeon visits, he will see how you are doing after surgery and assess your needs. A regular breakfast will be provided as long as you are not nauseated or vomiting. Generally, your oxygen, pulse oximeter, and IV fluids will be discontinued unless deemed medically necessary. Your IV will stay in place until discharge. If you have a hemovac drain, it will be removed by your nurse on the first day after surgery as ordered by your surgeon. Vital signs are continually monitored. The orthopedic spine nurse navigator will visit and give you your total joint replacement card, which documents your replacement and reminds you to have antibiotics before any procedure. Physical therapy will work with you in the morning and you will sit up in the chair. Continue to perform ankle pumps and use your incentive spirometer. If you meet your PT goals and are medically stable, your surgeon may discharge you home. On post-op day 2, your nurse will again come in your room in the early morning to draw labs. Your surgeon will review them prior to visiting you and then come and see and assess your needs. Regular meals are delivered, vital signs are monitored, physical therapy will work with you in the morning and have you sit up in the chair. If you reached your PT goals on post-op day 1, then you will not work with PT on post-op day 2. Continue to perform ankle pumps and use your incentive spirometer. The orthospine nurse navigator will visit and review your total joint education. If you meet your PT goals and are medically stable, your surgeon may discharge you home. On post-op day 3, your nurse will come into your room early in the morning to draw labs. This is so your surgeon can review the results again before he visits you. Your surgeon will visit and see how you are doing after surgery and assess needs. Vital signs are monitored. Continue to perform ankle pumps and use your incentive spirometer. The orthopedic spine nurse navigator will visit and review the total joint education. Generally, this is the day patients discharged to skilled nursing facilities due to Medicare's 3-night rule. Orders and a copy of your chart are given to the facility so they can care for you. Begin planning where you will go after surgery right now. No one should return home alone, and we want you to have a safe plan for your recovery. Your discharge plan is individualized for your needs and abilities. Total knee and shoulder replacements will attend outpatient physical therapy, while there is no formal physical therapy for total hip replacements. Need for PT is determined at your follow-up appointment. Following hospitalization, your discharge plans will be based on physician preference and your needs. Options include home with family or a significant other to assist in your care, home with home health care, home with outpatient physical therapy. Your physician, however, may recommend inpatient rehab. There are 2 types, subacute and acute. Acute rehab, such as Walton Rehab or Doctor's Hospital, consists of approximately 3 hours of therapy per day, and your stay in such a facility is shorter. You must meet medical necessity, work with physical therapy, and have insurance approval. In subacute rehab or a skilled nursing facility, you generally stay at the facility longer, and the hours of therapy per day are shorter. Your insurance must approve admission to a subacute rehab, which occurs after surgery and is also based on your ability to work with physical therapy. You must stay in the hospital for 3 midnights to qualify. Medicare Part A pays for up to 20 days in a skilled nursing facility at 100%. Most total joint replacement patients can travel home or to a rehab facility by car. Traditional total hips require special instruction on how to maneuver in and out of the car. Here are examples of different types of equipment you may need after surgery. Your physical therapist will evaluate you to see what equipment is needed. A rolling walker is used to help you walk and provide stability after surgery. A bedside commode or a toilet riser can add 3 to 4 inches onto your toilet height, which can make using the restroom easier after surgery. Traditional total hip replacements may want a long-handled bath sponge, reacher, or a long-handled shoehorn to help maintain their precautions. Shoulder replacements do not require any special equipment other than the shoulder sling. You will receive equipment prior to discharge home. If you go to a rehab facility, they will obtain your equipment before you are discharged from the facility. Whether you discharge home or to a rehab, your nurse will review your after-visit summary, otherwise known as an AVS. The AVS, which includes your new and current medications, follow-up appointments, signs and symptoms of infection, weight-bearing status, total joint precautions, and when to call your surgeon. Preventing post-op constipation is very important for your recovery. Drink 6 to 8 glasses of water every day unless you are on a fluid restriction. Get up and walk around every hour to keep your bowels moving. Add fiber to your diet with fruits, vegetables, and whole grains. If necessary, you can add an over-the-counter stool softener or laxative to help with a bowel movement. After surgery, it will be very important for you to know the signs and symptoms of infection. Fever and chills are common with infection. A low-grade fever after surgery is normal, but anything over 100.5 degrees Fahrenheit is considered abnormal. Remember, with fever you may have chills, so be on the watch for both symptoms. Redness or warmth around your incisional site is also a sign of infection. This will be redness or warmth starting at the incision and spreading out around the site. After surgery, a level of swelling is normal. However, swelling that does not go away with rest and ice is painful can be a sign of infection. Drainage from your incisional site can be normal, but drainage that becomes yellow or green and has a foul odor is considered a sign of infection. Pain that is not relieved by your prescribed pain medication is also a sign of infection. We want to arm you with the tools to prevent post-op infection. The 2 main tools are hand hygiene and personal hygiene. Hand hygiene consists of washing your hands or using sanitizer before and after meals, after coughing or sneezing, after using the bathroom, before and after wound care, and after touching pets. Personal hygiene is taking care of and cleaning your body and the objects that come in contact with your skin. After surgery, it is important to change your sheets weekly or if they are soiled, as well as showering daily and wearing clean clothes. Following your wound care instructions and avoid touching your incisional site except during the wound care. Do not allow pets to lie on or near your surgical site, even if it's covered with a dressing. Keep all pets away from the incision until it's fully healed. Here we see examples of both post-op total knee and total hip infections. Post-op wound infections often become so severe that the site can open up and have a large amount of drainage. These infections often require a secondary surgery and have heavy long-term antibiotics used. Your surgeon would like for you to refrain from being intimate for 4 to 6 weeks after surgery to allow your replacement to heal. Here is the orthopedic prayer. Dear Lord, grant me patience, but please hurry up. As this presentation comes to a close, I would like to recap a few things. Try not to get frustrated with yourself. Everyone heals in their own time. Be sure to move every day, but pace yourself with therapy. Take time to rest. Do not try to start back to household chores until you are healed. Eat a well-balanced diet. We want you to add an extra 250 calories per day to help you heal your incision. Drink 6 to 8 glasses of water every day. Get plenty of rest, but keep in mind your sleep habits may change until you're fully recovered. Also, no procedures for the first 3 months following surgery unless they are emergent. We ask that you sign up for MyChart through Epic. You can access a version of your Epic MyChart online. It can be done via a web browser or the app using the Google Play Store or the Apple App Store. You can view, schedule, request, or cancel medical appointments, request an e-visit, view your health summary, update medical information and history, view test results, request prescription renewals, and communicate with your medical team using Epic MyChart. Here you see an example of what the app looks like on your phone. There are several updates, and it is downloadable through the Apple App Store or the Google Play Store. Call for any questions. My name and contact number is located in the back of your total joint replacement book that was given to you today. Thank you for your time. If you have any further questions or concerns, feel free to contact the University Hospital Orthopedic Spine Nurse Navigation Department at 706-774-2760. Again, that's 706-774-2760. The University Hospital Orthopedic Spine Nurse Navigation Department.